All right, so going to give myself a quick introduction. I'm David. For those of you who don't know me, I'm the president of CAPS. And so this is one of our fireside chats. We do these about every week with different speakers. This week we have Dr. Rachel Klein. I'll give an introduction for Dr. Klein in 1 second. Coming up next week, we have Dean Dr. Andrew Sunshine, who is a pre-med, pre-dent advisor in GS. So he's going to be speaking with us for the first half of our event about, the process of what classes to take, admissions, things like that. And then in the second half, we're going to be doing a presentation from DAT Bootcamp, which is a test prep program. And at the end, we'll have promo codes and all sorts of good stuff for you. The week after that, the 17th, we're going to have Dr. Carl Blancioni. He is a dentist out of Florida, out of Orlando. He is the former team dentist for the Orlando Magic basketball team, and he was also a contestant on Survivor. And he's going to be telling us about being like a sports team dentist as well as just like private versus corporate stuff.
Can I join that one?
You're more than welcome to. But as for the introduction for Dr. Klein, Dr. Klein, thank you so much for being with us. Dr. Klein is a traveling dentist. She has made a career in treating homebound patients, particularly those in nursing home facilities and those with special needs like Alzheimer's disease or dementia. And we're very excited to have you here today and to learn from you and to be speaking with you. So without further ado, we'll get started with some of our questions. And usually when we do these, I like to start off with, a kind of basic question, kind of kick things off, which is, what made you want to be a dentist?
So I've always loved art and playing with things and creating things. And I thought, how great would it be to combine my love of art and science and helping people? I mean, it's the best of every world. So
yeah, that's amazing.
I'm not saying you need to have a love of art, but that's just what called me.
It's great when, we hear different angles because everybody has their own kind of twist on why they, got interested in it. And we haven't heard art before. So that's really exciting to hear that, you're able to bring some artistic flair to it. And we'll ask you about that actually in a little bit, probably. And kind of going off of that, I know, as per your resume and why you're here today, you're part of your career is geriatric dentistry. So what got you interested in that kind of angle, that specialization?
So I tried everything. I worked in private practice for over 20 years and I treated kids, adults, my peers, everything. But I would say that when I was about these girls' age, when I was in dental school, my grandmother was in Sloan Kettering and she was a really beautiful woman. And one day she took medication and somebody should have been there watching her and they weren't. And she got out of bed and when she fell, she broke her 2 front incisors. And I remember it was devastating because she really cared about how she looked. And like she would always say to me, why aren't you wearing lipstick? And why isn't your hair done? And those kind of grandmothers. And it just bothered me. And I remember I went with her to the dental office inside of the hospital. And I said, I have to do this because these are people that need to have their looks with them forever. Listen, of course you'll see people that don't care, but that's what called me.
And, part of what you do is, as, we introduced you before, you're a traveling dentist. So what made you decide to do that kind of angle, that at-home dental care, as opposed to having just a geriatric focused practice?
I like going into the home because these are really an underserved group of people. They can't get out of their house for the most part, especially now in these times. And for the most part, these people cannot even get out of their beds. I am basically seeing a lot of people in their beds. And you can even ask Malky because Nicole came with me and she assisted me. And she saw that it was in the bed that we were hunched over and, holding a flashlight. And, I do have a light that I wear, but I mean, I'm getting off topic, but the point is that, these people, they need help and they can't get out. They have pain. They broke their tooth, they broke their denture, and they need someone to come and fix it. So, that's why I want to do it. I also wanted to say that I once had a patient who I have a website, and I usually get questions like, or a whole biography, like, mom, we live in whatever city and she broke her denture and we need this, that, and the other thing. So she wrote a little something about how she had been to the dentist and they weren't able to treat her. So I called the daughter, then I called the dentist's office, and they gave very different stories. The daughter said they didn't treat her the way she wanted to be treated. They didn't speak to her the way she was supposed to be spoken to. Like she likes to know what's going on, and they just were very quick and abrupt with her. In the meantime, the woman has dementia, but she didn't tell the office that. And I think that being in the office really confused her. Everybody was wearing masks and, the facial shield and hats and, all these layers. She didn't recognize anybody. She didn't feel comfortable. And they didn't let the daughter in. And she ended up biting the dentist and the hygienist. And I said, all right, I'm going to go to the house and let's see what happens. And I went to the house, and her aide, who she knows, was in the room with her. Her daughter was there. She was very comfortable. I talked to her like, we just had a lovely conversation, and I saw some pictures on the side. I started asking her about the great grandkids and the grandkids and whatever holiday was coming up. And it was just a much more pleasant experience. I did not get bitten. I have my fingers. So, I think that's very helpful for a lot of dementia patients.
So you kind of outlined it a little bit there and got into it, but can you just tell us about maybe some of the unforeseen challenges of having to, treat patients in their own home or in a nursing facility?
Yeah. Well, in the nursing home, now things are different, but I'm doing it a long time. But back in the day, I would go to the room and maybe I had to make a denture, and, I try to keep to my schedules, and I'm going into the room, the patient is having their diaper changed, or the patient is in physical therapy, or the patient is in dialysis, or they don't speak the language, and then we need to get an interpreter, or we need sometimes to get, a computer where we can, or something, where a laptop or something, where we can get the child in who can communicate for us, and then they're not always going to answer the phone. So I can't get the work done if the patient doesn't understand, or they're too confused, or they don't know me, and we're all again wearing our shields and stuff. But in the nursing homes, it's a little bit harder, as opposed to in the house, where, like I said, there's always a translator, there's always someone who's available. And did I answer the question?
Yeah. So
Okay.
you had mentioned both the nursing home and the house. So that, yeah.
Mm-hmm.
um, and kind of going off of that, we had the challenges of being in a non dental office setting. What about some of the challenges? And I know you spoke a little bit about treating a dementia patient, but just an older population of patients. What kind of maybe unforeseen challenges come with that? What maybe is unique about treating an older population that somebody treating another population of patients might not experience?
Okay, so first of all, you have the dementia, and sometimes, like I said, you can deal with it. I have a patient who I have to go there, and every 8 weeks I see her, and I'm the only one, for whatever reason, that can remove her denture. It's attached by implants, and nobody can figure out how to get in there and get it out, and she doesn't let anyone touch her mouth. So somehow I go in there and I'm able to just, do it, and she allows me. But sometimes when I get there, she's very agitated. So I know this sounds crazy, but what I do is I leave the room, let her calm down, and she actually forgets about the fact that we saw one another. And then I go back in the room and then I try it again. And, she curses at me and sometimes she hits and spits at me, but, I am there to do a job, and I just don't give up because I want to help. Or, if there's a patient who is very aggressive or combative, and they need a tooth pulled, let's say, and they're going to start hitting me or spitting at me or kicking or being violent, I say to the family, unless we can sedate them, I can't treat them, because if you have a syringe, you cannot, take the risk of injuring yourself and the patient. So there are times when, you just cannot do it, and you want to, but you can't. So those are the limitations.
One thing that we talk about a lot in these fireside chats is fear of the dentist. Would you say that treating a population with dementia kind of compounds those fears?
Um, I don't I don't think it's the dentist. I just think that it's just being touched. And sometimes when they're in pain, they really act out because they can't express what's going on. So I don't think it's me. It's just any new person. And, they don't know what I'm there to do. It's just they don't recognize me. So that makes them fearful. But I also wanted to say that with older people, sometimes it's upsetting because, like, I'll walk into the room and I'll say to someone, you need to do X, Y, and Z with your mouth, and they're like, I don't know, I'm 97. How much longer am I going to live? And I'm like, well, you can't live with that tooth that's dangling in the front. We have to pull it, it's going to hurt you. And it's, God forbid, maybe be a risk that you'll aspirate it. So sometimes, getting the patients to consent to the treatment is a little bit of a challenge. But with the family on board, we can make it happen.
And do you see any, in the kind of specialty of geriatric dentistry, it seems that it's quite different than other specialties, just in that you have other kinds of things going on, whether it's the Alzheimer's or the need to go to a patient's home or nursing facility. Do you see that there are any, existing disparities in care that are kind of, that maybe are present in the treatment of older patients?
I think the difference with going into the home is that my relationship with the family is really, I'm very responsive. They call me, they email me. I mean, I can do that in an assisted living, but it's not the same. If they can't meet me in the house, and not all the families do, but I feel like people can get more involved when it's in the house as opposed to when it's in the assisted living or in the nursing home. So it's helpful when the family can get involved. Sometimes, like, I'll say, could you send me a picture of what's going on? And they can't, because they can't get in to see their parent. So it's really sad in a lot of these cases. They haven't seen their parents in months, and and that really doesn't help with the dementia, because the patients are getting more and more confused and more combative, and this is a real problem.
And kind of going off of that, how would you say, and especially with the way you practice, how would you say that the COVID-19 pandemic has changed how you have to practice? Are there different approaches that you have to take besides PPE? For example, like, do you have to change your, the treatment, like the trajectory of the treatments that you're doing for these patients?
I don't think I do. I mean, I've always been wearing a mask, but I used to be able to greet the patient without the mask. Now no one sees my face, which is, it's a little bit sad, because it helps you connect, and these people, they don't know if I'm smiling when I'm telling them a joke, but maybe they can, because you can see it in the eyes. But I think that with COVID, I I would say what I'm doing, I mean, dentists were always the most cautious, and, ever since the AIDS and everything else, we're always all gloved and covered up. Now I just wear a little bit more layering. And the only time that was really an issue for me, to be honest, was I'd say back in July. No, none of you are going to remember this, but it was around July 20th, and it was 96 degrees. And I think the real feel was 102, and a family whatever, didn't want to let me in the house. I understand, I'm not judging, but they made me work in the garage. And I was making a denture for their father. And he was sitting in the garage, I'll never forget, in his underwear. And it was a very, very hot day. And with all my layers and trying to do what I'm doing. And then they closed the garage door because they were cutting a tree down in the yard next door. And so I thought I was going to die. But other than that, wearing the PPE, for me, I get a little crushing on my nose sometimes, and, you break out a little, but other than that, you do what you have to do to help people.
So I was wondering, with the changes that have been going on, I know, like you just said, you've been seeing patients, but have you been seeing a rise in teledentistry at all?
Well, for me, that's what I always do because, like I said, if somebody's going to say mom broke her tooth or mom's crown or bridge or whatever broke or fell out, I need to see pictures because I can't just show up to your house if it's like an hour or even 30 minutes. I can't come there without knowing what I'm stepping into. I need to tell you what I have to do. I need to bring the right equipment. I need to be able to kind of figure out a price. And without seeing the picture, then I can't do any of that. But I can't treat anybody over the phone like a psychologist or another doctor can. But it does help me.
And another thing, is with working with older patients. How do you deal with when patients maybe take a turn for the worse or you lose a patient?
It happens a lot. And, unfortunately, I don't know about it until they tell me. And thank God it hasn't happened where I've reached out and followed up for a recall and they've said, I'm so sorry, but mom passed. Usually they tell me, which really is very touching. And I've been thinking all these months and years, and what should I do? I mean, I feel so sad. I really like we've had a connection. We've done months of treatment sometimes. I think that sending flowers is the right way, a card, because it's like your dentist. I'm really like, I hope they think of me like family, you know?
Yeah, I completely get that. I know it can, it's probably difficult to have that kind of relationship and then the patient passes away. Um, so, going off of that, what would you say is maybe like the most difficult part of your job besides maybe losing a patient or having to work in, 102-degree heat in a garage?
I think sometimes, I don't mean this in a mean way, but sometimes you deal with really crazy people. And it's not the patient, it's the family. And sometimes they're just really not realistic. But for many different reasons, like they expect a treatment and they're fighting with me. I mean, I know what needs to be done. I don't think you can tell me you didn't go to dental school, so you can't really say, let's just do this when I say that's not going to work, So you have to be realistic. And, there have been a couple of times where I want to please people. I try very hard, and then for whatever reason, I reach out to the previous dentist to get information, and the dentist will say to me, "Oh, just give it up. You are never going to make that family happy because they don't know how to be happy." So it's very stressful because I feel like I'm wasting my strength, my energy, and I can't please them. But there are people like that.
Definitely. And I apologize. There's a clock going off next to
Mm.
me, chiming. But going off of that, what would you say is your favorite part of your job? The thing that when you wake up in the morning makes you smile and be excited, ready to go to work.
I love meeting these people, and when they appreciate what I do for them and they say, thank you for doing what you do, it really makes me feel good. And the family is appreciative. And then somebody goes from having a mouth full of no teeth or missing, and and then I can replace it and help them smile better, eat better, feel better about themselves, feel, dignity. That just makes me feel good. I always show my kids like a picture and I say, look at the before and look at the after. This is amazing. So that's just really rewarding. And I also love to see how people love their family members and really take such great care of them. It's just so nice and, well, humbling, I guess.
And then, kind of thinking about geriatric dentistry as a whole, do you see if there are any misconceptions that people have about the specialization, things that, if you could say to, the whole world, like, this is what you're getting wrong about geriatric dentistry, what would you maybe say?
Um, I guess people think, these people are old, they don't care, they don't want it, they're not interested, but it's not true. You should see some of the people that I've come across, and they really do want to, besides eat better and gain back the weight that they lost because their dentures are missing, they just want to look in the mirror and feel better about themselves, or if they can FaceTime, if someone can help them with their family, or even if their grandkids or their kids come and see them, they can have their teeth in their mouth and feel better.
Yeah, I can definitely see why that would be, a really big part of adding to quality of life, especially in, older years. Um, it might seem like something kind of peripheral, but I mean, especially with gaining back weight and things like that, it's definitely really important. And one thing I wanted to circle back to as well is if you wouldn't mind just telling us a little bit about art, and your interest in art and how you kind of bring art into your practice of dentistry.
Well, I've really just loved playing with things like with clay and just like not so much painting. I have a daughter who's very good at that, but I'm more about the creating and taking shapes and making small things just turn into statues and things like that. I know it sounds crazy, but that's just what I always enjoyed. So there's a lot of aspects of dentistry where you really need to, I mean, not so much in geriatric because they're not really doing root canals at this point, but there are a lot of parts of dentistry where you really need to work with your hands and be very, very exact and specific with tiny, tiny things. So I'm glad that worked for me.
That's really great. And then, before we get to the Q&A, because I've been talking a lot and, I just have two quick questions for you. So the first one is, for predental students like us, do you have any advice or, things that you would want us to know looking forward to careers in dentistry?
I would say because there are so many aspects of dentistry, like when I was this age, I had no idea that I wanted to do this only. You really should try everything because the truth is that in everything that I've done, in every single aspect of dentistry, helped me get to the place that I am today. I mean, you need to know crown and bridge. You really need to understand and have experience in every single element to put it all together and, make it work. So you have to try everything to see what will work for you and what makes you happy.
And then our last question before Q&A is, if you could travel back in time and give yourself one piece of wisdom or advice, what would it be?
So I would say to just enjoy life and also take chances. I mean, I thought I did, but I guess I could have done more. And to know that, no matter what's happening, you're going to one day, if you want, be your own boss. And to me, that's the greatest thing. I never thought that that would happen. And I mean, I worked for other people for so long and I wasn't always treated right. And now I don't have to answer to anybody. If I don't want to go to work tomorrow, I won't, unless I promised them I was coming. But I can just pick up and go on a plane. Well, I can't, but or I can go to a movie. Well, I can't do that either. But you know what I mean. I would do those things if I could.
That's great. And now, like I said just a second ago, I've been speaking a lot. So if anybody has any questions that they'd like to ask Dr. Klein, You know, usually we're pretty informal here. You can kind of jump in, but if you feel more comfortable using the hand raise function or something like that, just so you don't kind of interrupt each other, you can feel free to do that as well.
I have a question. um, so I was very lucky. I was able to go with Dr. Klein on some of her visits, and I know I personally didn't understand really what she really did before I went with her, because when you think of a home visit, you don't really understand what that means. But I think it's like incredible the way you go to people's houses. It's very difficult the way you have to set up all your equipment, and it's very weird conditions to practice dentistry like that. So I was asking maybe if you could tell us like the weirdest or like hardest condition that you had to like practice on a patient.
Say it again. What was the question?
Oh,
What was the?
sorry, my Wi-Fi is really bad.
Oh, okay.
Oh, like the weirdest like conditions you had to practice on a patient or something like that.
Huh. Well, when you were with me, I don't think that we went to any hoarders' homes, but there are a lot of those. But let's reflect on that time where the cats were all over the place. Remember that? And there were cats on the bed, on me, on you. That was pretty psychotic. And I mean, I'm not afraid, so it doesn't bother me. But if you have a fear of dogs, cats, birds, and any other animal, then maybe you should get help for that before you go into this. And also, I'm allergic
Yeah.
to dogs, which isn't a problem when you're wearing 100 masks. So there's that.
But yeah, like there were so many cats, and you were so brave. You didn't even flinch. You just kept going.
Because it happens all the time. What am I going to do?
Yeah, it was crazy. I was shocked. I thought that was amazing.
I remember. I totally forgot about that until now, but that's funny.
I didn't forget.
It'll be in my book that I write.
Okay, I can't wait to read it.
One question that we had put in the chat, it says, thank you so much for your talk. Do you usually just travel in your town or a few cities close to your home?
So I live in Nassau County. I go all over Nassau. I go to Queens. I go to parts of Suffolk. I draw the line at an hour in the car because it's just not worth my time anymore, because it's an hour there, an hour back. And frankly, it hurts to sit so long. It's just, I'm getting old. I can't do it anymore. I'm just kidding. I just don't like to sit for too long. It's just not worth my time. So, and I definitely do not go to Brooklyn, but I work with another doctor who she covers Manhattan, and she's looking for someone who does it in Brooklyn. And she's also found somebody who does it in Chicago. And there's somebody who does it in LA. And, Dr. Kaufman is trying to make it a global thing for us, but it does exist. But just for our network, it would be amazing to have it in every state and help people all over the country.
There's a follow-up to that, which is if you want to be a dentist who travels around, do you need separate licensing?
You don't, but you would need to check with your malpractice carrier. That's something that you have to let them know. And you also need to buy a lot of equipment and there's just a lot of stuff you need to invest in as opposed to an office, but you don't have the overhead. But if anybody wanted to ask me specifics about, my instruments or, my anything, I would be happy if you gave them my number or my email. We can communicate and we can FaceTime. I could show you everything. I love what I do, and I want other people to do it too. So I'm happy to share anything I have.
Hallie, you put a question in the chat. Do you want to say it out, or do you want me to read it for you?
I can say it out loud. Do you treat patients with special needs that aren't able to like sit in a dental chair or go to a dental office? Or
Yes.
is it just geriatrics?
You know what? It's the name of the website is Geriatric House Called Dentistry, but people reach out to me all the time, and I've seen 30-year-olds, 40-year-olds, people with brain injuries, and they can't, they're like stuck at home. So I definitely do, but it's limited because they're younger, so their dental needs are different. So, I mean, I can definitely do a cleaning and I can do small fillings, but I don't have a drill and suction like you would in a dental office. So I can't really do a huge filling or a root canal because I can't really do that kind of thing in the house. I can't extract a wisdom tooth in your house, and that's really what younger people need. So I tell them all of these things and my limitations, and if I can help them, then I do. Oh, I got an email last week about a rapper. Maybe he's in his 20s. He's some famous rapper. I never heard of him. I promise I don't even remember his name. And I don't even think it's like OSHA or whatever, HIPAA if I told you, because we didn't end up treating him. But he wanted me to come to his hotel room in Manhattan and clean his teeth and whiten his veneers. I'm like, what are you even talking about? And what are you even doing here? Like, there's no concert. I don't understand. But anyway, I would have done it. It sounded like a fun experience. It was at the Mercer Hotel. And honestly, I don't even think I would have felt comfortable unless I kicked out his entourage, because it was probably going to be tons of people in there, which doesn't make me feel safe. But thank you for your question.
I actually have a quick question of my own, which is, and I know you've said, a little bit of it, but what are the types of things that you usually see as far as like dental issues that older patients have? Is it generally, I mean, obviously missing teeth, but beyond that, is it pretty much the same stuff that younger patients would have, or is there other stuff?
Okay, I wish I could show you pictures because my phone is insane with the things that people show me. But so I do cleanings, obviously, which people get. But a lot of times, let's say I see someone who the other day I saw a 105-year-old woman. I don't think she's had a cleaning in 3 decades. You don't see that with younger people. My hand was killing me. I was in agony, chipping away at the dirt on the teeth, and she was completely with it and telling me with her tongue, "I think there's a piece over here." And the room was so dark, and I was trying my best. I was on my knees because I was bent over trying to do the cleaning and whatever. So you have cleanings, you have different kind of fillings than a younger person has. A person 20, 30, 40, 50, they would have a filling, but an older person, we're not always going to put a filling in like you would have. We usually use something called silver diamide fluoride, which a lot of pediatric dentists use. It arrests the decay, and it will turn the tooth dark, and then you can put a filling on top of that. So we don't do that with in the regular office with the younger person. You just drill it out. But you can't really do that. We can't drill, so that's why we use that. Or a lot of times people have elderly people take a lot of medications and it dries out their mouth, so they get a lot of decay. So a lot of them have crowns and bridges, and the teeth underneath the crowns and bridges completely decay down to the gum line. So a lot of times I find there'll be a bridge and it'll be attached, like it could be 6, 7, 9 teeth, and they're all going to be attached to one tooth. So I have to go over there, and then I'll take it out, and then they'll say to me, "Could you cement it back in?" Or it'll have fallen out and they'll say, "Could you cement it back in?" And I see the teeth attached to the bridge, and I'm like, "No, we cannot," and then you have to go and then get all those roots out and then make them a denture. So these are things, you see with young people, although depends on what they do. If they're doing crack, I don't know, maybe, but I'm kidding. I don't know. And there's a lot of denture problems with these people. Dentures crack. sometimes the denture is being held in by one tooth. And like I said, that one tooth gets decayed. So then you have to take that tooth out and make a new denture. And there's this lady I started treating her in the beginning of COVID. I think I started back even in February. That's what happened. Her bridge fell out and I started doing some extractions. I made her a denture. And then over time, one by one, her teeth are decaying and I'm pulling them out, adding them to the denture. And I said, eventually we're just going to have to take out those last 3 teeth and make a full upper denture. And, she's a good sport. She's been allowing me to do it because she wants to eat.
Thank you for that. Another question in the chat is, if I'm practicing, how do I protect myself when I have to go into another person's home to treat patients?
It's basically the same as if you were in a dental office. I wear 2 masks, a face shield, sometimes. I mean, if you want to be really hysterical, you can wear like a hairnet. I don't do that. I wear scrubs and a jacket over me, and I wash my hands when I walk in. I sometimes wash my hands as I'm leaving, or I Purell in the car, and then I wash my hands when I get home. But it's the same type of thing. I mean, I like it when the family member and the aides are wearing masks. You can request that. I usually do, but obviously the patient isn't going to be wearing a mask, but I'm not really worried about that 98-year-old patient because I hope that they've been protected by the family. So, it's the same as in an office, in my opinion. Safer, because there's no drill and there's no aerosols and there's no, nothing spraying in the air.
And then also if a patient is, being a little bit physical or something like that, obviously they're elderly, but is there anything that you can do to kind of mitigate that?
If they're being combative?
Yes.
Well, if I need to do something, I'll recommend, having them take a Xanax the next time before I come. Or sometimes, there are different times of the day when certain people can be better behaved. So we try to do that. But if they're really going to, thrash and fight and kick, I draw my line because it's not worth it. And there are times where I can't do things and I send people to an oral surgeon or, a facility because they'd be safer there. And like I said, a lot of these people can't go, but if you really have to do it, then you have no choice. You have to go to the oral surgeon. So people find a way. They get the ambulette. They don't want to, but they do.
Hallie, you had another question?
Yeah. When in your career did you realize that you were ready to start your own practice and work for yourself?
So, if I'm being honest, I've been doing this for the past couple of years, but ever since March, I really have been working for myself because I used to work in a dental office up until Corona came. And then the minute it started, I said, I don't want to do that and see patients in their homes because I just felt like it was more exposure and I didn't want to risk taking anything that I might pick up from an office to someone's home. So I stopped. I do still go to the nursing homes, but I'm crazy careful there. And I have a good friend, and when it was really bad and there were a lot of patients with corona, I didn't go in there. And if there's a patient, I have a friend who tells me, what floor to stay away from. And again, I wear all my PPE, so I try to keep safe.
Nicole, I think you're up next as well.
My internet's a little spotty, so let me know if you can hear me. But I think this is just like what I don't, her name isn't in the chat, but what someone else was trying to ask, like, how do you ensure you're going to like a safe home, that the patient is really who they say they are? Or
I think that's a great question, and it's really funny because when I first started doing this, I remember I I always used to be on the phone with my daughter, and I would say, okay, listen, I'm going to this address, and if I don't walk out, please tell SVU that this was where I went. But it's never a problem, because if you talk to the person and you find out what the problems are with the mouth and you get pictures, who can fake all of that? Who's gonna lure me to the house with fake teeth? And sometimes I really need to know very detailed information. I need to know the medical history, the medications. I need to talk to the doctor. Like, I don't think anyone is that crafty that they're gonna make all of that up just to put me in danger. So, but it is a good question. I'm never scared. I don't know why. Maybe I should be, but I'm not. Oh, yes. Once I got a guy, he emailed me, and I thought it was really weird. He was 40 years old, and I said, are you homebound? He said, yeah, I don't have a car. I said, that's not homebound. You don't have a car, but you can leave your house. He's like, no, I need help. I need to have somebody look at my teeth. I said, so you could take the bus to the dentist, or maybe a taxi. I don't know. I'm not coming to your house. And I happened to look him up on Facebook, and he was a scary, scary character. So yeah, you have to, stay away from the young men. That's a red flag.
I want to know, what's your favorite tool that you use?
My favorite tool?
Mhm.
Gosh, I have so many. I don't know. It depends. I buy a lot of toys, but my newest fun thing is, which you haven't seen because I got it recently, is my loops. They make you buy them when you go to dental school, and I did buy them, and it was a huge waste of money because I never used them. But now I love them because I really I learned to appreciate them. And in addition to the magnifying, which is very helpful, there's a light, and it's attached, and together with the magnification and the light, it really like changes everything. Before I would have my miner's light or flashlights, but I can walk into a dark home and never be worried again. So that was a good one. It was a worthwhile investment. And I have other friends who I speak to about other instruments or equipment that will help me make my life easier, and I'll try them because it's worthwhile.
Because you're dealing with older patients, before you start doing working on them, whether it's cleaning or maybe a more invasive procedure, do you have to do like check their vitals or anything to make sure they're good to go?
I don't, but sometimes there are things that you have to do. When you go to dental school, you learn all of this. But if somebody has, they're on blood thinners, or they have a heart condition, you always have to know if you're going to do an extraction, what medicines they're taking, and you have to speak to the doctor and find out how many days in advance should they stop that medication, like aspirin or Coumadin or Eliquis. That's very important. I have another patient, and she also has a platelet disorder, so we always need to know her numbers. But I don't, I don't do their vitals. Maybe I should, but I don't. I've never had, thank God, I don't want to jinx myself, but I never had an episode like that. But when I was working in a dental practice, I once gave an injection to a young girl, and she fainted in my chair. And that was the scariest thing ever. I don't ever want to wish it on anybody or see it again. It was terrifying. But, with elderly people, you're in their home. So if they're diabetic and their blood sugar goes low, the juice is right there. So it's different. I know in advance what to look for and what problems can arise. So, and like if you see they're looking a little funny, you lower them, and you kind of like want to raise their legs and that kind of thing. But you learn all that in dental school. Like, you need that for every patient, not just for the geriatric population.
Does anybody else have any questions? Well, thank you so much, Dr. Klein, for coming and speaking with us. It was really great getting to hear from you. We haven't heard of anybody until you speaking about geriatric dentistry, so it was great to hear about a new specialization and get a little bit of an insight into what you do and kind of the things that are interesting, good, bad, all of the different aspects of geriatric dentistry. So we really appreciate you coming by.
Thank you for having me. This was really an honor, a privilege, a pleasure. Thank you. And I hope all of you, have success. And, if you ever have any questions, seriously, please call me. I love to talk and I'm happy to help.
Thank you so
Thank
much.
you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Good luck.